All right, so I want to welcome everybody for joining us. My name is Dr. Michael Fernandez, and joining me today is Kara Rubinich. Rubinich.
Either way.
Either way, it's fine by her. This is a little bit of a follow-up to our previous discussion about initiating and progressing a running program. We also talked a little bit about injury prevention and complementary exercise training. So today we're going to do a lot of demonstration. So we've got some special guests here today. We have Peter. Say hi, Peter. And we have Katie, who's hiding at the moment, but she wanted to join us. And we're going to be going over some great complementary exercises that you can add to your program. We're going to talk about how you can modify those exercises and implement them into your training regimen in order to improve your running performance, as well as try to prevent some common injuries. So, Kara, what do you want to start with?
Yes. So, a lot of the discussion that we had in the webinar last time was, either you're already into the running program or you're just done. And I said, don't go too far, too fast, too quickly. And we really talked about how important it is to, we can work out 5 days a week, but maybe not run 5 days a week. It's kind of too much on the overload of your body. So if you still want to get some fitness in, it's great to be fit and then run. So strength training is a huge part of injury prevention, especially in that initial foundation phase and beginning phase. We think of strength as weights, but almost anything here you can just do on a bench at the park. You can do in your basement, the steps, wherever you have just a little bit of room. We try to make do. So the first thing that we're going to do is bridges, but it's not the bridges that my daughter Kate can do and arch her back. It's the supine bridges to really work your glutes, hands, and hip adductors, which are actually a huge important of the chain of when you're talking knees and ankles too and strengthening. So if you two don't mind, why don't you lie on your back and pop up into a bridge and see how their heels are on the ground at first, their legs are together, so they're also working their adductors and they're really pushing up with the glutes. And really, you should feel a nice stretch. Your hands are flat on the floor so you don't cheat with your hands. And you can, that's, I'd say, stage one. And then if you want to, you can always raise the right leg up in the air without lowering your hips. You can do some flex and points. So I like to always add something else and work on that dorsiflexion as you do it. And then drop that leg. Don't drop your hips. Do the other leg. And then come on down. And then once you take a break, if that does nothing for you, you pop right back up into the bridge. And then get up on your heels and slowly walk your feet out without dropping your hips. Toes up, Katie, toes up. On your heels. Now, there, then you're isolating the hamstrings a little more and walk your feet back in.
And I'll even encourage people while you're doing the bridges to point your toes up towards the sky.
Yep.
It's going to engage your posterior chain a little bit more.
Yes.
Engage the hamstrings and glutes as well. And then one modification to the bridges we can add to this, if you're not really feeling any fatigue with it beyond the ones that you're doing,
right.
If you have weights at home, placing a weight across your lap as well.
Or you elevate it, so you go onto a step, and then the degree changes the angle of which you have to work from. But Kate, you would probably want to come in and make sure that your knees are bent a little bit, I would say.
And your heels are way too far.
And you're okay.
I can feel the edge, Kate.
And this time, your feet are dorsiflect again, so it's just your heels popping up. Good, and you can even do some raises. So you lower and dip up and down, and up and down. And feel free to correct the instructor when you want.
Yeah, what I'm going to have you do, though, is try to keep your knees apart. Don't let your knees kind of squeeze together. So you want to keep your knees apart, and otherwise.
So think of that nice line in parallel, not leaving it, just like the squat,
nice and
Katie.
straight as you
don't want your knees. At the same time, you don't want them flopping out because you also want to be working your adductors.
Exactly.
So there's a fine line. You want to think of a parallel line straight down. Okay? Good job, you two. Okay. Good. All right. The second thing that we're going to talk about are lunges. And I think the lunges are really important to every runner, and they may not be their favorite thing to do. So what I say is if strength training is not something that you care to do, that's exactly what you should do. Go for something that isn't what you like to do, because that may be a sign of like that's what you need to work on. So with the lunges, here, you want to do the lunge or you want mom to? Okay, so with the lunges, we're just going to step forward on one leg and then come back, okay? And when you step forward, you're working on a lot of balance and hips and glutes and weight balance. So there's a lot of things going on here. You want to lunge, if you're doing a far lunge like he is, then it's going to be working more on the glutes. But if you shorten your stride, then it's going to be more on the quads. And when you do, you want to make sure that your knee does not go, you want to freeze. Your knee should not go over your toe. You don't want to put extended pressure. Why don't you keep pausing there, okay? You don't pause down on the lunge. There, you pause. So you want to make sure you have weight in the heel too, okay? So it's not all on the forefront. He's doing a good job. He knows not to use his hands and put his hands down on there. And then you can step back and you can alternate it by stepping backwards. And you can step side lunge and do a side lunge as well. Good. Now, when you go back, you've got to keep a track on those knees. That's the most important thing. Again, just like he said, your knee has to go not anywhere over the toe, okay? Good. And the whole time you're trying to stay tall because you want to run tall. So you don't want to be leaning over too far, all right? Peter, you want to come back so he can demonstrate and point out a few things?
All right, so I want you to face the camera for me, Peter, and then go ahead and do your lunge for me.
And hold it.
Okay. So again, one thing you want to look for is trying to kind of keep this knee in more of a neutral position. Usually if you have a little bit of weakness in the hip area, you're going to see this knee kind of dive in this way a little bit. That's what we call a valgus position there. So that's what, sorry, I know you're dying here. Come on up. So that's something you want to try to keep an eye on and work on in order to really fire those lateral hip muscles, which are really important for stabilizing the knee. One of the things that's often underappreciated is the fact that with a lot of knee pain, the issues are usually a problem at the hips or the feet. The knee is a relatively simple joint, and it usually, when you're having pain at the knee, is the result of something going on at the hip or the foot. So when we come in and we examine knee pain, a lot of times you'll find that your physical therapist would be looking at the hips or the feet. And people are like, why are you looking at my hips and my feet? It's those muscles and it's the stability there that oftentimes translates to issues of the knee.
It's the chain reaction. Usually there's something going on, not where the pain is referring to, it's below or above.
The one other thing I might encourage people to do is, Peter, let me have you face sideways for me and do that same lunge. Is maybe trying to keep that back leg straighter. So if you step out further, come on up for me, Peter. Just try to step out further to keep that step back knee a little bit straighter. That's really more so that you just don't come down and bang your other knee on the floor.
Okay.
Yeah, it's not overly crucial from my perspective, but I usually encourage people to do that just so that they can, avoid any chance of banging that knee on the floor.
Okay, great. All right, so now we're going to move into squats, and there's so many variations of squats. So Katie, do you want to show we always like to start with the isometric where you hold it, because then you can actually work on your positioning before we start to do little plyo squats. And there she has good traction. Her knee isn't over and her knees are not caving in. She has a really tall spine and her arms are straight, and it looks really strong to me for a 7-year-old. She has a little weight in the heels, and she just has to hold that. So her body is sending messages of what needs to be firing up. You got it. 5, 4, 3, 2, 1. Right. Sometimes, it depends upon your natural curve of your hips and pelvis if they tilt out a little bit, but usually you want your feet hip width apart and just beneath your shoulders. So you're kind of in an A-frame. I like to put my arms straight out. You really want a nice, you know, flat back, and you want to sit. You really want to think visually on that bench right there as you sit.
Yeah. I
Okay.
usually if people imagine like you're sitting back in a chair,
Mhm.
and I want the weight to come back more on the heels than the midfoot or the
You
toes.
should be able to wiggle your toes while you're in the squat. You don't want to be leaning like this. With a lot of my youth, I see them hinging over, and then they're going to be firing up the wrong muscles. You want some action and some firing with the quads as well as the glutes on this one. Okay. Peter, do you want to do some pop squats and a little more advanced? So once you've kind of done that as a warm up, do you want to do pop squats? Okay. All right. You can take it to a couple different levels, but you want to watch your knees. Don't cave
you face
in.
the
So can
camera
you face
for us?
the camera? Yep. So you jump up and then you pop down. You jump up and make sure your toes don't turn out and your knees don't cave in. So if your knees cave in, you may want to think about taking it back and maybe not do the pop squats until you have that muscle control and memory control in that isometric, and then load yourself and do the squat. She is the gymnast who does a couple more
Not
jumps a
doing it
day.
right.
But again, you see your knees caving in? Good. Yeah, you really have to concentrate on the outside and working that out. Because again, if your knees are caving in, that's not the natural alignment of the knee.
Yeah, and this is, again, usually a progression once we get the squat looking really good. When
Yeah.
we start to see that good hip and knee control and you're able to do a really stable squat confidently and comfortably, at that point, then we might progress to this.
Right.
So like you were saying, Kara, once you get that quality control in the squat, if you're not having that good quality control in the squat yet, then I wouldn't jump into the more advanced exercise like this until you get that quality movement
Right.
control like Kara was discussing.
And I mean, you can progress just by setting a stopwatch. Say, okay, I'm going to do 10 seconds in the squat. I'm going to do 30 seconds in the squat. I'm going to do 90 seconds. I'm going to get up on my toes. And you're still not using any weights, but yet you are firing up those muscles and you're engaging them throughout and slowly building up. And you also want to be careful. What else have you done today? You don't go sprint and then try to do a lot of this as well.
Yep. All right, what do you got next for us, Kara?
Okay, let's see. Do we want to do a couple of, why don't we do the heel raises with the ball and then go into the box jumps? Because I feel like that's a good warm up.
Give them a little bit of a.
Yeah.
Here. All right.
Yeah.
So
Okay.
I'm going to actually start with the short foot. So can I have someone pop their shoe off for me?
Like that. You guys can both try it.
Those are just one.
Let's do both.
Who wears new socks? Me?
A gymnast.
If my mentor saw me, she'd be upset that you had shoes on at all.
I know. It's actually a good thing for this exercise.
All right. So what I want you to do is face me, Katie. I want you to step forward with this foot here. So what we're going to do is, this is called a short foot exercise. The goal with this one, if you're a pronator, is yep, thanks, buddy. If you're a pronator, and if you're a runner, you may know already know what I mean by this, but a pronator is somebody whose arch tends to kind of drop and the foot tends to roll inwards when you're in that weight bearing or that foot strike position. And so sometimes that can be improved with addressing some of the weakness in the muscles in the foot and the ankle here. So this is a great one for pronators in particular. So you're going to leave the foot here. What you're going to do is I want you to imagine that there's a triangle underneath your foot. Right underneath the ball of the big toe, right underneath the ball of the pinky toe, and right under the ball of the heel. And I want you to bring your weight forward over the foot so you have equal weight on all three of those points of that triangle. Okay? Once you're there, I want you to think about rooting the toes into the floor so that you raise the arch of the foot. So we're not trying to scrunch the toes. However, if you're starting this initially, you're probably going to scrunch the toes quite a bit because you don't have that foot control yet. So as you get more confident and comfortable with this, you should be able to root those toes and raise that arch without scrunching the toes. So what I want you to do is you're going to try to shorten this and raise the arch of the foot there. So give me a good, so keep your toes down. Try to squeeze. There you go.
Like a bridge.
Yeah, so it's almost like a bridge for the inside part of your foot. So it's pretty challenging to isolate those muscles. Okay, but try to keep that heel down. All right, so the whole foot should stay down, and you're just trying to squeeze and raise the arch of the foot. So keep those toes down, and then pull there. So keep that heel down. Good, good, good. Keep that knee over the foot. Good. Just like that, a nice solid contraction there. And what I'll do is I'll have you hold it for, usually I'll have people hold it for 5 seconds, do 20, 30, 40 repetitions, because it's really about getting that, neuromuscular control that probably hasn't been there for a while with the foot. And this is a pretty challenging one for people to do.
Yeah.
Then what I'll do is I'll follow that up with an exercise that is, go ahead and leave those off for me here. Is something called a heel raise ball squeeze. The goal with this one is also to target some of those muscles that help stabilize the foot as well, and it works really well in conjunction with the short foot. So you can go ahead and stand against the wall for me, Katie. And what I'm going to have you do, you can go ahead and relax your feet for me, is a place a ball right between the feet. So the feet are about the ball's width apart. So you come up on your toes and try to pull the heels underneath the ball. So you're not trying to smash the heel together like this. You're more trying to come up and then scoop them under. So come on up and then squeeze those heels under together. Hold, squeeze, 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 squeeze. And you're going to do that 5-second holds for about 20 repetitions. What we're doing here is firing a muscle that comes down here and then attaches down in that inner part of the foot. And really, that muscle is really important for trying to help stabilize the feet as well.
And probably prevent some Achilles.
All right, you're all set there. All right.
Those exercises are always good. You can just keep the ball, I would say in the bathroom or in the kitchen, and those are nice when you say that you don't have time to do some strengthening. You clearly have time to sit and actually move your foot and try to arch your foot, or you brush your teeth. This is like hygiene for your body. So when you're brushing your teeth, you can do those raises. You have 2 minutes to brush your teeth. Do the raises while you brush your teeth. You can find time to do that, and consistency. So the more that you do it, then it just becomes habit. You don't think about it. It's not added time. It doesn't take away from your run. It's just built into your day.
You can do it in line at the grocery store.
Yeah, exactly. And then people are probably like, "Oh, what's that?" And then they're gonna try it. So share the knowledge. Okay.
All right. What do you want next for us?
Petey, do you want to do some ladders or do you want to do some box jumps? Ladders? All right. So we're just going to move into a couple little bit plyos. And plyos are always good because they work on cadence. And a lot of times, if you do some jump roping or ladders or any sort of jumps, just a couple minutes, maybe twice a week. I would suggest no more than 3 times a week. Then it helps your body get used to the overload. So then whenever you try to sprint, then your body is kind of used to that overload. It can be up to 10 times its weight whenever you really pick up the speed, which is good. Short practice, and not to mention it's good also for the change in cadence. So your cadence is how quickly your turnover is when you run, the steps per minute. And generally speaking, I'm a marathon runner, and we tend to have maybe longer strides or not as high strides. So this is a great way to shorten your cadence and work on some new muscles and get the fast twitch going, and maybe have some injury prevention whenever you're doing a speed workout. It's really important to keep doing. You can do all different things. It's also good for lateral movements. So if you're a soccer player, lacrosse player, any sort of player, you know, most of the day we run forward, we walk forward, we watch TV forward. We even get out of the car and we turn. So any sort of lateral movements, that's going to help build muscles that are weak to encourage injury prevention as well. So Peter's doing a great one now that involves a lot of stability. You want to take it slow as you can. You touch down and you reach back. Hopping is great, little hops. You can go nuts. Agility ladders are like $10 on Amazon. And if you do these a couple minutes a day, especially before going out for a run, I think that first half mile is going to be a lot more productive half mile. Whenever I have clients and I say warm up for 10 minutes, it's not necessarily a slow jog. I want a dynamic warm up to really get your muscles awake and alive. So that's where we're going with those.
Great.
Yeah.
Anything else?
No.
Okay. I do want to go over one other one here, is the lateral step down.
Okay. Yes.
So let's cover the lateral step down, and then we can talk a little bit about some injury prevention and what to do if you're having problems. So this one I will use a lot of times in the office as for multiple reasons. I'll use this next one as an assessment to see how your hip control is. We talked about the importance of the hip muscles and stabilizing the knee. And if you're having trouble with this one, the likelihood is that when you're running and you're exerting that force on your heel strike, that you're probably not going to have that hip knee control in that environment if you can't have the hip knee control in doing this. So what I'm going to ask Peter to do here is he's going to have one foot on the side of the stool, and then he's going to come down, try to tack the heel, and then come back up. All right, try that for me, Peter. Okay. So yeah, so I want you to try to come down nice and slow. This is a pretty tough one, right? So there we go, better. Good. So one of the things I'm really looking for here, what is that knee doing, right? So that knee tends to come in, come inward towards the midline. We call that, again, that's a valgus position of the knee, where you're getting that knee kind of coming inward. Typically a sign that we need to improve the functional hip strength of the abductor muscles and the glutes to help control that. So, good. So if this height is a little bit challenging, what I might do is I might drop down the step to maybe a 4 or a 6 inch box. This one's a little bit higher than I'll usually start people on, so that they can get that, start training that movement, training those muscles as well.
Which is probably the step that you had at home on your step.
Yeah. So that's a great one for strengthening those hip muscles. Now, if you're a female, you're going to tend to have a little bit of normal valgus because of the having wider hips typically. So there's some anatomical things there that you're going to be a little bit more prone to that valgus position. That doesn't, just because you have a little bit of valgus does not automatically mean that your hips are weak or anything like that. I'm looking a lot of times at the stability and the control, right? Because again, especially with our female patients, having, anatomically speaking, having wider hips, they tend to have more of a valgus position at the knees anyway.
Right.
And so that, is going to show up when we do this.
Okay.
So I'll be looking for the change in position or the change in that valgus position as when I'm assessing whether or not I believe that hip strength is where I want it to be.
Okay.
Okay. And then I have one last strength one, then we'll talk a little bit about, I'm not going to make you guys do this one with this man because that would be pretty terrible for you. This is one of my favorite exercises. So with that lateral step down, I'll use it as an assessment, but we can also use it as a training tool. Find a lower step and do repetitions. So doesn't matter, even if you're getting a little bit of that valgus,
Yeah.
keep working on it. So I'll usually, if you're a distance runner or a marathon runner, I might have you do, trying to do 20, 25 repetitions with a 30-second rest. I'll have you do repeated sets, 4, 5, 6 sets in order to build up the endurance of that, because it's not just a strength thing, but we also need that carryover of the endurance. If you're an endurance runner, we also need to train for that as well.
And Dr. Mike's also a former soccer player. So similar, the soccer players are on the field for upwards of 90 minutes running several miles. So even though you may have a clean, efficient run and feel great that first half, how do you look that second half of the game? And that's where you have to go for, rather than necessarily adding weights to what you're doing, go for the endurance, go for many sets, many times. So you have to alter your workout, your strength workout, to what you're doing at the current moment or where you want to be, 8 weeks, 10 weeks out.
Yeah. So this last one we're going to show you here, these bands are pretty cheap online. You can find them anywhere. This exercise is really for hammering these hip abductors and the glutes. So what I have you people do, most of the time you'll see the band around people's knees. So that's one way you can do it. That's kind of usually where I'll start people.
Okay. Yep.
You can also do it around the ankles. But the key with this exercise when I demonstrate it is that we want the toes pointed forward.
And the knees not.
Yep. So I want the butt kind of to sit the butt back a little bit so that you're kind of engaging more of the posterior chain. I don't want you more here. So I'd rather have you here instead of here. Okay, so that's the difference in position there. Toes stay forward. If I start turning the toes out like this, I'm going to start engaging more the hip flexors than the hip adductors. So toes forward, I'm going to step and then bring the other foot in. Keeping tension on the band the whole time. A lot of times what we'll see is this, and then people just let the band snap them back.
Yep.
So instead of letting the band just snap you back, I want you to, using control, bring that foot back.
Okay.
What I prefer, if you do it, is putting that band around the toes, because naturally it's going to pull your feet in this way. So you're going to have to engage the rotator muscles of the hips in order to keep the toes from coming in this way.
Right.
So this, people tend to feel this a little bit more
Okay.
than around the ankles or the knees.
Right.
So then again, same position, butts back a little bit. I'm not here.
Yeah.
I'm more here.
Okay.
Toes are staying forward, stepping out, in, keeping tension on the band the whole time. I'm not letting that band pull me in.
His toes are straight forward.
Yeah.
I
So,
feel like that's an important one for those who kind of kick out whenever they run.
Yeah, and especially if you're looking at your knee and what it's doing and you're getting that valgus position with the lateral step down, this is absolutely one that I would give you.
Okay.
Okay. And with that, I'll go until you pretty much are burned out. Usually we have about 15, 20 feet, and we'll do back and forth as one lap, maybe go 2 to 3 laps. At that point, you should be pretty burned out.
Yes. Yeah.
And
I
if
think
not,
that's something similar, and it doesn't get any easier any day.
no. And if it is getting easier, then it's time to bump up the resistance or increase the distance that you're actually doing. Yeah. So, Carrie, you wanted to talk a little bit about, I'm just going to move this a little bit closer here. And if anybody has any questions for us, you can type those into that question and answer box on the Zoom link. So, Carrie, you wanted to talk a little bit about what to do if you're starting to feel pain, what you can do if you're starting to feel like you might be having some difficulty.
Right. I work with a lot of youth, and this summer, we've kind of progressed slowly. Like, that's the main key is don't just go into something full force, and don't expect, even though these are strengthening prevention, injury prevention, don't expect for them to work overnight. It takes a while to see results. But if you're already experiencing pain in the knees or the heels, when is it time, I'm assuming that you already know to take a couple days rest, maybe ice or heat, and I've ibuprofen or something if necessary, and it still hurts. When do you know when to see an ortho, a pediatrician, for an evaluation and from there?
Sure. I think touching on the heat or ice thing, there's a lot of people like, that's a common question we get. Should I heat it? Should I ice it? And the reality is that unless it's in that you're in that acute pain phase where it's been within that first 48, 72 hours, there's probably no benefit to icing.
Okay.
It's not going to hurt you to do it.
Yeah.
It's certainly not going to harm you. So if you feel like you're getting benefited, I encourage people to do it.
Right.
But beyond that, there's really not, a lot of research that shows that ice or heat really changes the functional outcomes. So we've kind of gotten away from that a lot in our clinic because the research doesn't really support it a ton. Again, if you're in that acute phase where you go out, maybe you step wrong and you roll your foot or ankle, then yeah, sure, absolutely. I would say, yeah, go ahead and use the ice. But as far as like even having some kind of gradual onset pain that's kind of lingering for a couple of weeks, it's probably not going to have much of an effect either way if you're heating or icing.
Okay.
I generally stay away from making the recommendations on over-the-counter anti-inflammatories only because everybody responds to them differently. So there are side effects to those that it can affect your digestive system and decrease the lining of your gut, contribute to ulcers. So I just caution people on that. It's really their own decision whether to use that or not. I just like to caution people on that because a lot of people, will use those without, pop them like candy. Yeah. And, I just want people to be aware that there are some potential issues with that. Generally, as far as, when to seek help, if you rested for a couple days, maybe lowered your mileage, lowered the intensity of your stuff, the intensity of your training, and you're not really able to kind of ramp back up, at that point I might seek some assistance. And generally speaking, if again, certainly I'm biased here being a physical therapist, but generally speaking, what's going to happen is you'll probably go to your primary care doctor because you have the pain. They'll probably refer you to an orthopedic specialist who's probably going to bring you in and then refer you to physical therapy. So the reality is the ortho is probably not going to do any type of functional movement assessment. And the reality is that that's probably what most of the time you need. The only way we're going to find out what you really need to do to correct the underlying problem that's leading to your pain is by doing a physical assessment. And so what I recommend for people is there's a couple options. Depending on your insurance, you do have the ability to seek a physical therapist directly. Okay. So you can certainly check with the insurance. It depends on the state, it depends on some of the insurances, but most insurances allow you to go directly to a physical therapist if you're having symptoms or issues. At that point, we'll assess, okay, if there's something acute or something where we maybe suspect there's a stress fracture or some other thing going on, we'll screen for that. And if we believe that's the case, then we probably would refer you to an ortho because you may need some imaging. But in the vast majority of cases, people who are having some of these pain in the knees, the ankles, things like that, don't need the x-rays, don't need the MRIs. There's the cost element to that. There's the time and the waiting element of that. And most people don't need that. Right. So we'll screen for that at our office. Certainly if you have a physical therapist that you're familiar with and you trust, I encourage you to seek their advice as well. Doesn't have to be us, but if you have someone that you trust, by all means. But I think that too often we kind of get through this. Like I go to my primary, then I got to go to ortho, and I got to get the imaging. And then after all that, you get sent to physical therapy. And the reality is we're not going to use the imaging to diagnose what you need to get better because the imaging doesn't tell us what the underlying impairments are. And a lot of times the imaging can also lead to some false impressions. Mm-hmm. It's not unusual. The research shows that 40% of people over 40 have knee osteoarthritis. Whether or not these are asymptomatic for people that don't have pain. So if you have knee pain, you go to the ortho and they do imaging, chances are they're going to probably find some arthritis or something in there. That doesn't really tell me how to treat you. It just tells me that you have some arthritis, which is pretty typical over the course of the aging process. So I think that's important for people to know as well,
Right.
because a lot of times then people kind of, especially runners, and being a former runner myself, I used to have this mentality that, well, running's bad for my body, it's bad for my joints, it's bad for this and that and the other thing. The reality is that the incidence of knee pain is lower in runners than non-runners.
Right.
And
Yeah.
so there's also evidence that
Strengthening
suggests,
yourself
your body
as
is
you run.
Yep, your body's responding to the forces that you put on it. And a lot of times, even some of the density of the bones and some of the fat pads in those joints are actually better in runners than non-runners.
Right.
So I think it's important to appreciate that as well, that, you don't necessarily need the imaging.
Right.
Okay. Yeah, if it's an acute thing, you roll your ankle and you can't put weight on it.
Right.
Then yeah, you might want to rule out a fracture depending on how serious it was.
Mhm.
But that's something that we can certainly assess once we're in the office.
I think it's also important to know that, and I speak out of previous knowledge, is that if you or your child is suffering a little bit of pain and it's gradually increasing and the tolerance is decreasing, many of the youth and runners, I'm guilty of it right now, is that you kind of want to run through it, or it'll work itself out. It's because I did a track workout and then I'll figure that out later down the road. And it really was more than just the track workout itself. But you want to know that that it's not necessarily a shutdown. Go to the doctor and they're going to shut you down. There are all sorts of alternatives, cross training. And especially I would like you to speak to like the knees or severs and Osgood-Slaughters. It's like, okay, yes, there's something going on with the growth plates, but maybe if you can strengthen everything around those, then you may not have this problem, for several years, because I know that sometimes it's kind of doom and gloom of what you read or what you hear, and not necessarily. And I don't want, the last thing that you can do is defeat and deflate yourself, but rather just see it as a little journey and learn from it.
Yeah, I think the other thing too is shutting down. I talk to people all the time about shutting somebody down.
Yeah.
I think you and I have had this discussion. My goal is never to shut anybody down unless I think it's absolutely necessary. There is, in most cases, we can reduce what you're doing and keep you as active as possible while we address some of those underlying reasons why you're having the pain, and then ramp you back up from there. And that often is a lot easier than shutting down someone completely, but typically you go to the doctor and the ortho, even unfortunately some physical therapists, who will, the automatic default is you're having pain, let's shut it down. But the reality is that not everybody needs that, and we have had a lot of success with just saying, hey, maybe you're a 50-mile-a-week runner, let's maybe drop it down to like 15, 20 while we address these things and then build you back up, versus putting you in a boot because you have foot and ankle pain. And then now we've got to deal with the stiffness that comes with that.
Right.
The other consequences of putting someone in an immobilizer, which is often the case when you go to some places and get experiencing pain. As far as severs and Osgood-Slaughters, those are often associated with, adolescents who have maybe especially had some growth spurts. And what happens is the bones typically grow faster in adolescence than the muscles can keep up with. And then it creates tension either on the back of the heel in the case of severs, or in the knee in the case of Osgood-Slaughters. And so, yes, and then the thing is, a lot of times, again, these kids get shut down. And the reality is, I don't want to shut a kid down if I don't have to.
Especially during this time.
Yes, especially during this time where they're trying to get that energy out. They're trying to stay active. So I'm going to do everything I can to keep that child as active as possible. I may shut them down if I need to for a week or so we can kind of, take hold, but I'm not shutting them down for a month and then trying to build them back up. I'm trying to keep them as active as possible, because that activity and that movement is also going to help us reduce the pain, as well as prevent some of the other deconditioning things that we've then got to work through at the end of our plan.
Yeah, motion is lotion.
Yeah, absolutely. A lot of times, if you or someone you know of has had Osgood-Slaughters or Sever's disease, a lot of times we can make some really good changes. We just need the right stretches and exercises for that.
Yeah.
And then once you stay consistent with those, it can really help reduce your incidence of return.
Great.
All right.
Okay.
So it doesn't look like we have any questions typed into the box. So if you do have any questions, please feel free to reach out. You can reach Kara at her Facebook page, facebook.com/krubinich. And your email is krubinich@gmail.com. So you can always reach out to her for that. If you have questions about, physical therapy, pain management specifically, and you feel like you want to reach out to myself, my email is Mike, F as in Frank, @kineticptpa.com. And if you want to go back and review this session, we will have it on our YouTube page. That should be up within the next couple days. And it'll also be on our Facebook page, probably be up there for a little while. You can see that. But our YouTube page, if you go to youtube.com and search for Kinetic TV, you should be able to look up this as well as some other content that we have there.
Awesome.
All right. Kara, I appreciate you joining us.
Thank you.
Peter, take a bow for me, please.
Woo.
Katie, come on in. Take a bow for me, please. Thank you all for joining us. And thank you guys for joining us. We appreciate it having you. Take care.